All right, thanks everyone for joining our webinar on sleep hygiene. Today we'll be specifically talking about sleep hygiene for the whole family. And we know that sleep is really important for cognitive, emotional, behavioral, and physical functioning. Getting adequate sleep is important for the health of all family members, particularly during times of stress and adjustment. And during these times of quarantine, that can make maintaining sleep routines and getting enough rest pretty difficult. We designed this 1-hour webinar to help families understand some sleep requirements, identify signs of sleep issues, and provide in-depth tips and interventions to improve the whole family's sleep hygiene. So a little bit about us. My name is Nandita, and I am a master's level clinician working towards my doctorate degree in clinical psychology at Pacific University. Another presenter is also Kayla, who is also a master's level clinician at Pacific University working towards her doctorate in clinical and adolescent psychology. So as an overview, we're not here to sleep shame parents. That's not the goal of this webinar. And during this COVID crisis, there's a lot of strain on parents, more so than usual, to be doing everything perfectly for their children's well-being. We don't want parents to be leaving this webinar feeling as though they need to completely adjust what they're doing, but we hope that those of you who are watching and listening can weave this webinar with a small intervention that you can take away and improve your children's sleep. We also want to urge parents to consider how this information relates to your own sleeping and how you can best support yourself during stressful times. Just like in an airplane where the protocol is for parents to secure their own oxygen masks before securing their child's mask, it's important for you to take care of yourself first so you can more effectively take care of your children. That being said, if something is working for you, keep doing it. We're assuming that people who are interested in learning a little bit more about sleep hygiene tend to have something going wrong a little bit, but if it's working for you or if there's something that we don't mention that seems to be going well in your family, keep doing it. Some of the types of questions that we'll be able to answer tonight are some of those questions around general tips to improve your family's sleep hygiene. And if you're struggling to see improvements or if there is an untreated medical cause to you or your child's difficulties, we recommend reaching out to a professional to develop a more individualized plan. So the importance of sleep. Across the lifespan, sleep is very important for all members of the family. And that can look like affecting attention, memory, learning, behavior and emotion regulation, language and communication, mental and physical health, and it can include things like accidents, injuries, hypertension, obesity, diabetes, nerve pain, hormone functioning, depression, self-harm, and suicidal thoughts and suicide attempts. And if you're schooling from home, a child who's deficient in sleep may have a hard time paying attention, getting motivated, remembering, and encoding information. They may be more prone to temper tantrums or being emotionally and behaviorally reactive, and that may look like crying or getting frustrated really easily at math problems or something like that. They may also have a hard time verbalizing and expressing how they're feeling and intensifying their difficulties. So as a parent, you may have a similarly difficult time engaging in your obligations, whether that be at work or childcare or the other duties that you may have. It's possible that you may forget things often and appear snappy and have a difficult time communicating with your children or your partner or coworkers or whoever's in your other life. Long-term, sleep deficits can significantly impact mental and physical health, which is why medical doctors and psychologists often look at sleep as a potential cause or contributor to some seemingly unrelated difficulties. And that may be hypertension, pain, or depression, some of the other things that we talked about. So the American Academy of Sleep states that healthy sleep requires adequate duration, appropriate timing, good quality, regularity, in the absence of disturbances and disorders. So almost half Americans don't fit this definition, with teenagers and parents of young children making up a large portion of this. So take a minute and consider who in your family doesn't fit this definition. Is it you? Is it your partner? Is it your child maybe? To clarify, the most recent recommendations on sleep, the CDC recommends the following age-based requirements. Napping is very typical up until age 5, and then it starts to become a little bit more based on the needs of each individual. Napping into and throughout adulthood can be healthy. However, it can also be detrimental to your sleep hygiene. With many people staying at home currently, it's really likely that napping is more accessible to both children and parents. And so we'll touch on napping a little bit more later in the webinar to discuss how to nap healthily. Some common difficulties that people often face is too little sleep or too much sleep. And a lot of how we decide to intervene with sleep difficulties depends on what kinds of difficulties we're having. So with too little sleep, that may look like you or your children having difficulty falling asleep or not really wanting to go to bed and maybe throwing a little bit of a tantrum at night. It can look like difficulty staying asleep, waking up multiple times per night, not being able to fall back asleep once woken up, or it can look like waking up too early. Another difficulty, like I mentioned, is too much sleep. And so that can be oversleeping, taking long naps during the day, and frequently sleeping. Also, needing frequent and long naps for school-age children and older is another difficulty that we commonly see. Sleep may be impacted by psychological issues, and that can include stress, adjustment, anxiety, depression, or nightmares. Consider the circumstances of quarantine right now and the major adjustment to the routine and the challenges to emotional well-being that we're having. Sleep may also be impacted by medical issues, such as sleep apnea, snoring, hormonal imbalance, restless leg syndrome, pain, or some effects of medication. Hormone imbalances can affect your circadian rhythms, which ultimately control your sleep and wake cycles. Sleep can also be impacted by normal developmental phases. During some periods of development, it's expected to see disruptions in sleep as different hormones are at different levels. And sleeping may also be affected by co-sleeping. And co-sleeping can impact everyone's ability to get restful sleep. But this may also be an important and valued part of your household. So consider whether your co-sleeping is an intentional decision or is it a temporary fix to a problem. And that problem could be bedtime refusal, frequently waking up, crying, or maybe it's your own anxiety. Some signs of sleep deficit are, there are some obvious signs and there are some more subtle signs. So the obvious signs may look like difficulty waking up, looking or feeling tired and not refreshed, so waking up and feeling kind of groggy, not really feeling you got quality sleep, needing frequent and lengthy naps, falling asleep unintentionally during the day, looking or feeling burnt out significantly before bedtime, and excessive oversleeping on non-school or work days, really feeling kind of exhausted. Of sleep difficulties might include hyperactivity and behavioral dysregulation. So that might look like excess energy. Maybe your children's acting out a little bit. It may also look like emotional difficulties, and that can manifest as anger, sadness, anxiety, or frustration. It may also look like affecting relationships, work, or academics. It may also look like your children is a little bit more accident prone, a little bit more clumsy. Now we'll hand it over to Kayla for tips for improving sleep.
Okay, thank you, Nandita, for letting us all know about issues of sleep. So now that we can say that you might have some difficulty with sleeping, here are some great tips for improving your sleep. And again, always address any possible medical causes with your pediatrician or doctor. These tips that I'm going to be giving are really great behavioral ways to address sleep, but they're not going to fix anything that might be underlying. So definitely consult with your doctor or pediatrician if that is happening for you. We're going to talk first a little bit about some general approaches you might want to consider for those non-medical issues. So first is shaping. This is the idea that you want to start small with a small adjustment to behavior. You want to reinforce it and gradually increase your expectation. You can use this by looking at all the tips we're going to give you and maybe choosing one of them to start with. Once you kind of master that, you can move on to the next one. Start small and then just get bigger as you master more and more. Fading is another approach that you can use. So this is where you're providing large amounts of help for behavior, reinforcing that behavior, and then gradually decreasing your involvement. This is really, really helpful for parents with younger kids. A common example is if your child is getting out of bed frequently at night, the parent might have to initially provide a large amount of effort and help in extinguishing that behavior. So you might have to sit and monitor really closely to make sure they're falling asleep. Maybe you're laying in bed with them to help them calm down. And then gradually, you're building up to leaving the room. So maybe you are sitting next to the bed, and then maybe you're kind of sitting by the door. Maybe instead of being there for 30 minutes, you're only there for 20 minutes, and then 10 minutes, and then 5 minutes. So you're slowly decreasing your involvement. That's fading. And our last one is co-regulation. This is using the relationship between two individuals to develop self-soothing skills. Kids not sleeping well, maybe your spouse not sleeping well, you not sleeping well, that can be really, really stressful, particularly if you're not getting good sleep yourself. So going back to that oxygen mask analogy, it's important for you to take care of your needs first before you can really, really help anyone else. In order to respond effectively to other people's needs, you have to be aware of your own reactions during stressful times, and you can't do that when you yourself are stressed out and tired. When we are able to self-calm and respond in an effective and compassionate manner, it helps the other person stay level as well and regulate themselves. It models regulation skills and allows the other person to kick in their own ability to self-soothe. So what I want you to take away from that is know when you need a breather, know when you need to cope with your own dysregulation and your own stress and difficulties before you might really engage with someone else. So for example, if maybe your spouse or your kid is just kind of really activated, you can be like, hey, I think I just need a little bit of space to breathe, and then I'll come back in 5 minutes and help you. We're now going to move into some, with those general approaches, we're going to talk more about tips now that you can use. So during the day, you want to make sure that you're waking up at the same time every day, even on the weekends. If you're not feeling rested or having a hard time waking up, it may mean that you just need to go to bed a little bit earlier in order to get more sleep in the night. You and your kids shouldn't have to make up sleep on the weekends, and that indicates that you're not sleeping enough every day and that you need to kind of prioritize that more during the week as well. You can also use light to help you wake up. So turn on lights, open the shades right when you wake up, because what that does is that really sparks your circadian rhythm. That natural light, that light really helps spark a biological response, and your circadian rhythm is your body's physiological response to the sleep-wake cycle. So really make sure that you're using light to boost that. Exercise is also really important. In the morning and afternoon is best because it is an activating activity. So you really want to do that earlier as possible. But it's going to help you. If you activate yourself early on, that's going to help you have more energy during the day and then sleep during the nighttime. You also might want to consider, if you have kids, what is their typical recess schedule like? And during quarantine, you might want to build that in during the day and make sure your kids are getting as much, if not more, physical activity than they were if they were in school. You also want to decrease any caffeine, nicotine, or alcohol. Caffeine and nicotine are stimulants, so they're going to keep you up. And caffeine has a half-life of 6 hours, so that means if you are really wanting that caffeine to be out of your system, you have to be drinking your coffee before noon. And alcohol, even though that is a depressant, so that means that it's going to kind of mellow you out and just kind of make you feel more tired. Even though it does that, it actually decreases the good parts of sleep, which is the REM sleep. So you might tend to fall asleep faster if you're drinking alcohol, but it's not going to help you get the good quality sleep. You want the bed to be for winding down, sleeping, and intimacy only. It's really hard right now with quarantine because you're kind of just in your house all the time. So the bed might be a place where you're answering phone calls, doing homework, doing work from work, all sorts of different things. And you want to make sure that that is just time for you to feel relaxed. So no work, no playing, no screen time on the bed. So during the night, it's really important that you maintain a bedtime routine and consistency. So that may look like having no screen time 1 hour before bed. Screens have blue light, which really impede with that circadian rhythm. It sends signals to your brain that, hey, it's time to wake up. So you want to make sure that you have a filter on your phone when it's nighttime, and then also just decrease your screen use in general because it's going to be really activating. You also want to choose some relax and unwinding activities. In 2 slides, we're going to go over some actual activities that are evidence-based to improve your relaxation and sleep. So we'll get to that in a little bit. But you can just start to think about, what might I like to do at night to kind of just feel relaxed, to leave the stress of the day behind, and to feel like I can get in a mode to get some good sleep. You also want to have lights out at a consistent time. So again, that sleep-wake cycle is really important, and light plays a big, big role in that. Make sure that your space is good for sleep. A good space for sleep is a space that is quiet, dark, and cool in temperature. You want to have clocks that are facing away from you, or just not have the clocks near you at all. Because especially if you are someone who feels really anxious about the amount of time you're getting to sleep, clocks can really, really facilitate that anxiety and make it worse. So making sure that there's no clocks, don't check the time at night, just make sure you have an alarm so that you wake up in the morning, but make sure no clocks are near you. And again, that light can also be something, if it's a really bright clock, it might be keeping you up. If you have a young kid, something that might be really, really helpful is sticker charts or bedtime pass. So if this is looking for kids in the school age range, these are really, really awesome. So you can make a bedtime pass that is given to the child at night, and it is exchangeable for 1 trip out of the bedroom for a short and specific activity. So short meaning less than 3 minutes, and specific meaning it has to be for something, for a reason, not just to kind of roam around the halls. So some examples might be, maybe they want to use the bathroom. Maybe they want 1 more hug from mom. Maybe they want a drink of water. Those are really great specific activities that can be done within 3 minutes. After completing the action, the child will give back the pass and is expected to return to bed. Parents should return the child to their room without comment, so don't look at them, don't activate them, don't ask them questions or talk to them much. Just kind of bring them back to the room. And if they start to call out for more, you just want to exercise some ignoring of that behavior. So every night the kid will get 1 pass. You can also use sticker charts, and I have some examples of that. Here are some awesome sticker charts for kids who are school age. So this first one is my stay in bed sticker chart. This is really, really helpful. So they have a morning, a nap time, and a night time for every day of the week. You want to make sure that there are rewards that come with sticker charts. So they get to put a sticker on, and if there are like 5 stickers, they get a prize. And make sure that you give that prize as soon as they earn it. And make it frequent. Don't have it be, well, once a week or once a month you get a prize, but make it something that's more frequent than that. And if you have a psychologist that you're seeing, this is a really good activity to kind of talk with them about, so that they can tell you, well, how frequent is good enough, especially for your individual kids, because the needs are going to be different for every child. And this other sticker chart's another example. This one is for more if you're having a hard time getting your kid to go to bed. So not just staying in bed, but just getting them to go to bed in general. So these are some great ideas of things that you can use with your school-age children. If you find that you or your child, you're staying in bed, you're trying to sleep, but it's just not working, and within 20 to 30 minutes you're still awake, that is a great time to get up and get out of your bed and do something that's more relaxing. The purpose of this is that, again, if you are someone who kind of ruminates and gets anxious and thinks about how many hours of sleep you are getting, just staying in bed, you're gonna really start to relate bedtime with stress, anxiety, and just that ruminating thinking. So get out of bed, do something relaxing. Once you feel more calm, more sleepy, you can then go back to bed and try again. And if you don't fall asleep again within 20 to 30 minutes, you can get back up. And this also can go with kids too. But you want to be mindful that they're not just kind of trying to get out of bedtime. So if they're really, really trying to sleep and within 20 to 30 minutes it's not working, have them do a relaxing activity. And that could be like reading a book, maybe coloring, petting a stuffed animal, something that's just calming and not activating. Something else that has some evidence base is melatonin. This melatonin is a naturally occurring chemical within our body, and so it is safe for humans to use. You want to definitely consult your pediatrician and follow any directions for specific ages and sleep difficulties, because that will determine what the dosage is and what the timing is of taking that. But melatonin can be really helpful. We also recognize that if you all are a part of children's program, or if you have a kiddo who has a difficulty, then you might have some specific diagnoses that might be impacting their sleep. So we wanted to spend a little bit of time addressing just some of these worries. This is not a conclusive list at all. This is just some of the biggest worries that we see that might impact sleep. The first one is anxiety and worry. So if you or your child have those, you might want to think about scheduling worry time during the day and replace bedtime and planning time with a relaxing activity. So you might say, okay, so I know I'm really anxious and I worry at nighttime. So what I'm going to do is at 5 o'clock, I'm going to spend 10 minutes writing my journal. I'm going to spend 10 minutes talking to mom and dad and just getting all my worries out. And then when it's nighttime, have a really solid relaxation activity that can distract you and replace that worry time that you're used to having right before bed. If you or your kiddo struggles with depression, routine is really key. And one thing we're seeing here in COVID is routine is much more different than we're used to. And maybe it is a lot more lacking than it used to be. We're not going to school, we're not going to work. Bedtime might be a little bit more loose, but really if you have depression, routine is really important. Depression and sleep go hand in hand, and there actually have been a lot of theories about them being linked together. So it's important that you maintain your sleep as much as possible. And it's really important that you don't exceed the recommended numbers of hours of sleep in particular. So make sure you're waking up at the right time, going to bed at the right time. If you're feeling really tired, try to resist the urge to take too many naps. Keep it within the healthy nap length, which is about 20 to 30 minutes. If your kiddo has ADHD, it's really important to be mindful that stimulants impact sleep. They are activating. So if you or your kiddo is taking a stimulant and you're feeling like it's impacting your sleep, you might want to discuss with your prescriber about the type of medication, the dosage, and the timing of it, and see if there's anything you can do to adjust that. If you have ADHD, you might also experience feeling really distracted and stimulated at bedtime. So it's important to make sleep a safe space that's free from distractions. So that might mean if you have an Xbox in the room, removing that. If you have 100 books there that you always just like to look at while you're falling asleep, maybe taking that and only having 2 next to you. So just removing any distractions. Again, it might be really important with ADHD to replace the active mind time with a relaxation activity, something that's going to calm and soothe you. For parents and kiddos who have autism and sensory difficulties, you might want to consider occupational therapy. They are great when it comes to these concerns of sensory concerns. So really check them out and ask for a referral if you would like one. Something that we talk about is a weighted blanket and calming sensory objects. These can be really, really helpful if kiddos are just feeling overwhelmed, or if you're feeling really overwhelmed, just to have something physical to kind of bring you into your body and not into your mind as much. If you have been listening to this presentation and you're like, you know, I'm still not sure why I'm not sleeping well or why my kiddo's not sleeping well. I just know that there is an issue and I don't know exactly what's happening and I don't know exactly how to fix it. That's totally fine. What I want to urge you to do is to maybe track how your kid is sleeping or how you are sleeping. So a formal sleep study is really, really useful, and they actually have come a long way. You might think that a formal sleep study is going to a remote location and getting hooked up to all these things and spending the night outside of the house, but they're progressing their technology really fast. So I urge you to give it a try. A lot of people can do a formal sleep study in their home now. You might also consider doing your own informal sleep study. So that's just journaling and tracking your own behaviors. This is really helpful because you can go to your doctor, your psychologist, your pharmacist, and say, hey, this is specifically what is happening. And they can help pinpoint and give you some interventions to help you and your kiddos. So some ideas you might want to think about is, okay, when are they falling asleep? When did they go to bed and when did they fall asleep? How often are they getting out of bed? What are they doing when they get out of bed? When do they wake up in the morning? How frequently do they wake up in the middle of the night, and for how long? How many times do their bodies move? Do they kick their legs a lot? Do they move in their sleep? Do they sit up in their sleep a lot? Are they having nightmares or night terrors? Are they snoring or holding their breath? Sleep apnea is one of those things that can be really, really impactful for sleep and for the health of individuals. And kids are not immune to sleep apnea, so keeping an eye on that for your kids. And then you can also think of how frequently are they using the toilet? Are they getting out of bed to use it? Are they urinating in the bed? These are all things that can be really, really important and can tell you a lot about the quality of your sleep. So journal those and talk to your healthcare provider about it. So here is that slide that I alluded to of a list of relaxation activities. We have 4 general activities that we tend to like to give out. And there are so many different scripts and videos and audios that are out there for each of these different types of relaxation activities. So the first one is a guided imagery. This is where you are either thinking to yourself or you're following a script or a video, and you are trying to kind of just imagine something and guide yourself through it. You're getting in touch with your imagination and thinking about the smells, the sights, the touch, the sounds you're hearing. And what that does is it calms your active mind and it gets you kind of distracted and calming down. Mindful breathing is really helpful for stress reduction and sleep. We tend, when we're really nervous or really stressed out, we tend to breathe shallowly and in short, quick breaths. So learning how to do the good diaphragmatic breathing is so, so helpful. When we sleep, we naturally have that breathing. And so learning how to do that when you're awake can help you get into that relaxing mode. Body scans are amazing. They're one of the things that I always recommend to people. This is something that will get you out of your mind and into your physical body. And so this is something where you are going through each part of your body, all the muscles, and you're just scanning it. So you might start down with your toes and just think, what are my toes feeling? Do I feel the socks, the blanket? Are my toes cold? Is there pain? Is there tension in my toes? And then you're going to work your way up to maybe the heel of the foot, then your calf, then your thighs, then your stomach, and work all the way up to all your body parts. With kids, you can do a body scan in a fun way, thinking about just the different parts of your body and having fun with it. And so really think about how you can incorporate that when you're going to sleep. Progressive muscle relaxation is very, very similar to a body scan. And this one is really fun to do with kids. So you're gonna, again, think of all the different muscles in your body and slowly work to see what it feels like to be really active and then to let it go and feel relaxed. So you are gonna tense each muscle part just one at a time, and then you're gonna relax it. With kids, this could be like squeezing lemons in your fists and then letting it go. Or squishing mud in your toes and then letting the tension go. Or being a turtle and going into your shell and then letting it go. So there's a lot of really fun ways you can do progressive muscle relaxation with the whole family. But these 4 are evidence-based and can really help you get into that relaxed state. We have some ideas for getting started, because it doesn't just have to be something that you do in your mind, but you can have people guiding you online. There's a lot of awesome places on YouTube. So if you just search up like kids mindfulness sleep script, you can get some awesome resources. Or for you, if you wanted to learn how to do some deep breathing techniques, you can go onto YouTube and search it up and have some awesome people guiding you and showing you how to do that. The UCLA Mindfulness Awareness Research Center has wonderful resources. They have a free website and app that you can download onto your phone. And that comes with a library of guided meditations. And they have weekly drop-in virtual meditations that are free. So you can go, I think it's every Thursday at noon maybe, and you can just drop in for free and do a mindfulness meditation. They are definitely more geared towards adults, but you can take some of their scripts and make it more fun for younger kids. But if you're a teen or an adult, it's definitely a suitable place for you. They also offer their meditations in Spanish, and they have just the scripts. So if you're hearing impaired, you can read along. The relaxation and stress reduction workbook is awesome. This workbook has just hundreds of different activities that you can try, and it has worksheets so that you can learn more about your body, your stress, and your relaxation responses. And there's also a nice list of mindfulness books for kids. If you Google that, there are some really good websites that just give long lists of different books that you can buy for kids. And the one that I have is pocketmindful.com. They have the 21 best mindfulness books for kids, and they go through and tell you the different age ranges that might be appropriate for that book. And that's a really great way to build in a natural relaxation routine. So every night, reading a different book with your kid, and having one that is really focused on calming and teaching your kid how to learn those coping skills can be really, really helpful part of your routine. So that's all that we have today. Thank you all so much for joining our webinar. We hope that you left with something that you can use for yourself or for your kiddos. It was definitely nice to have you all join us. If you want more information or want to get connected with services, here is our contact information. Thank you all so much.